So once again, welcome to our online tutorials. And today we'll be dealing with histology, and this is the part 2. We are having a histological specimen of a kidney, which shows a part of the distal tubule going between the afferent and the efferent arteriole. Afferent and then efferent. Afferent, when we say afferent, that means going into, then efferent, leaving. So afferent arteries and then what? Efferent arteries. Arteriole. That's the smallest part of the artery. The cells building the tubule wall has a dense nuclei. The basal membrane is absent. Which structural formation is shown over here? Which structural formation is shown over here? Okay, people are coming in, so I have to add them. All right. So the cells build the wall have a dense nuclei. So your clue here is what? A dense nuclei. Dense with no basal membrane or absent of basal membrane. So what structural formation are we looking for? Again, we are talking about a dense nuclei, And these are closely packed specialized cells that are very, very sensitive to the concentration of sodium chloride. These dense cells are specialized to be sensitive to the concentration of sodium chloride inside the distal convoluted tubule. The distal convoluted tubule. And again, they are telling us that this specimen is found at where? At the distal tubule or the distal convoluted tubule. So over here, we are looking at what? The macula densa. Macula densa. Even if you can remember that the name of the nuclei or the dense nuclei that they possess. The dense nuclei that they possess. And again, they are found on the distal convoluted tubule. They are found on the distal convoluted tubule. And again, I said these are very sensitive to what? To sodium chloride. Sodium chloride. So what it means is that when there's a decrease in sodium chloride concentration, these cells decrease their resistance to blood flow in the afferent arteriole. They have what? Decreased resistance to the afferent arteriole. And then it will cause an increase in renin release. And this renin comes out from the juxta glomerular cells. These renin come out from what? The juxta glomerular cells. Juxta glomerular cells. So please take note. So in an exam, when they ask you what is the function of the macula densa, what will you say? They helps to regulate the concentration of sodium chloride, as simple as ABCD. So over here, we're looking at what? The macula densa. So C should be your likely diagnosis or your likely cell. Macula densa. All right. Now we have a patient with injured muscles. Patient with injured muscles of the lower extremities was admitted to the traumatical department. Due to what cells is reparative regeneration of the muscle fibers and restoration of the muscle function possible. What it means is that it's just like when you get injured. When you get injured, you don't expect the deformity to be there forever, isn't it? You expect it to grow and then perhaps heal. So the question now is, which cells helps in healing? Which cells helps in healing? Which cells helps in healing? So you are looking for what? A regenerative what? Cells. A regenerative cells or cells that can undergo regeneration. So anytime you get injured on your skin, the reason why the skin is able to form a scar is because of what? These cells. Because they are growing to come and replace the lost tissue. And these cells are called myosatellite cells, popularly called satellite cells, satellite cells, satellite cells. So these are the cells that are found in muscles that helps us to regenerate or restore lost tissue or restore lost muscle fibers. Lost muscle fibers. So over here, we are looking at for what? For satellite cells. And these are stem cells. Stem cells, stem cells, stem cells. Okay. So again, they help in what? Regeneration. Regeneration of the muscle tissues. The muscle tissues. So your answer is A. All right. In the course of an experiment, a big number of stem cells, guys, you can see stem cells again. Again, stem cells are involved in what? In regeneration. In other words, they are the genesis of every cell. They form the foundation of the development of every what? Cell. The foundation of the development of every single what? Cell. But look at the question. The question is what? There is what? A big number of stem cells of red bone marrow was in some way distracted. That means it was destroyed. These stem cells have been what? Destroyed. Look at it. There's a regeneration. I told you. Regeneration of which cell population in the loose connective tissue will be inhibited. Will be inhibited. Now, don't forget that red bone marrow are responsible for what? For blood cells, isn't it? Red bone marrow are responsible for what? Blood cells. They are responsible for blood cells. So you ask yourself, so if the stem cell is destroyed, looking at the options, which one of them is a blood cell? Which one of them is a blood cell? And again, your answer will be what? A macrophage. Macrophage. Because macrophage is the same as what? Monocyte. 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 And monocytes are part of the what? The blood cells. Now, when we talk about blood cells, we're not referring to just RBCs. We have RBCs, we have WBCs, we have platelets. So don't always think that when we talk about blood cells, we're talking about red blood cells. No. Macrophages, they are all blood cells. They are all blood cells. So over here, what tissue or what loose connective tissue will be affected the most? And your answer is what? Macrophage. Macrophage. So your answer is what? Is B. Macrophage or macrophages. Macrophages. All right. Histological examination of a 40-year-old man's thymus. Thymus. You know, the thymus also helps in the storage of what? Lymphocyte, isn't it? So lymphocyte can go into the thymus and grow inside. So that's how maturation of lymphocyte takes place inside the thymus. But over here, that's in the hand. So the man's thymus revealed a decreased share of parenchymatous gland element. There is an increased share of adipose. Adipose means fat. There is an increased share of adipose and a loose connective tissue. Its enrichment with thymus bodies. The organ's mass was unchanged. The organ's mass was unchanged. What phenomenon is it? What phenomenon is it? Now, don't forget that as you grow, as a human being, as you grow, your thymus also begins to what? To shrink. As you grow, your thymus also begins to what? To shrink. So there's always correlation between the age of the individual and then the thymus activity. The age of the individual and the thymus activity. And the thymus activity. So take note of that. So again, basically that's what it is, all about. And this woman or this man is 40 years old. 40 years old. 40 years old. So it is, it is normal for the parenchymatous gland cells be decreased. And when these cells that are responsible for everything is decreasing, they are being replaced with fat tissues or with fat cells, with fat cells, with fat cells. Okay, they are being replaced with fat cells. So over here, we can, simply put, everything is matching with the age of the person. Assuming this person was a baby and then the gland is reducing, then there is a problem. But over here, we can simply say this phenomenon is called age involution. Age involution. That means because the person is growing, these elements are what are being replaced with how do you call it? Fat tissues. Fat tissues. And at about 50 years of age, about 50 years of age, about 90% of your thymus will be replaced with fat tissues. At 50 years, about 90% of the gland will be replaced with fat tissues. So please take note. And this person is 40. So definitely, this person is having what? An age involution. Age involution. So the answer is E. Age involution. All right. A histological specimen shows a blood vessel, okay? Its inner coat is composed by endothelium. You know that every blood cell is underlined or is lined by an endothelial cells. Endothelial cells. But look at it again. It has endothelial cells, subendothelium, and then internal elastic membrane. But look at it. They said the middle coat is enriched with smooth muscles or smooth myocyte. The middle layer is enriched. That means that if you take the whole vessel, the middle layer is very, very obvious that it is enriched with a lot of what? Smooth what? Muscles. And the question is, what type of vessel are they talking about? What type of vessel are they talking about? If I were you, I'll write this down. Now, the wall of any vessel, we have three layers for every vessel. It has 3 layers. It has 3 layers. We have the inner layer or the tunica intima. We have the inner layer or the tunica intima. Then we have the middle layer or the tunica media. Middle layer or the tunica media. And then we have the outer layer, also known as the tunica adventitia. I repeat again. We have the inner layer called the tunica intima, the middle, tunica media, and then the outer layer called the tunica adventitia. The tunica adventitia. Now, the tunica intima differs from the inner layers of a lot of arteries. Okay, the middle layer too will be different, and then the external layer too will be different. So depending on what they are describing, it will help you to know whether this is a vein, is an artery, or is a capillary, if I put it that way. All right. So these are the things that you need to take note of. These are the things that you need to take off. So now let me give it to you. Now, if you have a vein, or let me say an artery. Now, every artery, it has a lot of what? Elastic membrane lining the artery. It has a lot of what? Elastic membrane. Elastic membrane. The middle layer is composed of a lot of what? Elastic membrane. That is for elastic type of artery. And the question will be very, very, very clear about it. The question will be very, very clear about it. So when the middle layer has a lot of elastic fibers, that type of artery is called what? Elastic type of artery. When the middle layer have a lot of muscles, we call it what? The muscular type of what? Artery. The muscular type of artery. And then when the outer layer has a lot of adventitia, that is a vein. That will mean that if there's a lot of adventitia on the external membrane or the outer layer, the middle layer will not be made of anything, or it will be low. Even if they are muscles, they'll be low. So these are what helps us to distinguish between an artery from a vein. So again, how will you distinguish between an artery from a vein? Look at the middle layer and then look at the what? The adventitial layer or the outer layer. So for arteries, the middle layer could either be what? Be made up of elastic tissues or muscles tissues or muscle fibers. Then in vein, basically, the outer layer is made up of what? A lot of adventitia. Good. Now let's look at the question. They are saying that the middle layer is enriched with a lot of what? Smooth muscles. That means that this type of artery is what? Is a muscular type of what? Artery. Artery. Not a vein, but what? Artery. So don't go and confuse yourself. Muscular type of vein. I think in vein, the adventitia will be more. The adventitia will be more. Good. So over here, we are thinking of what? Of E, the muscular type of artery. Artery. So please take note of what we have just said. All right. In the course of indirect histogenesis of tubular bone tissue, a plate is formed between the epiphyseal and then the diaphyseal ossification centers that provides further lengthwise growth of bones. What structure is it? Now, what they are trying to tell us is that anytime you have a bone, assume this is a bone, okay, the edges or the external edges are made up of some cells that help it to grow. That helps it to what? To grow. What is the name of that plate? That is all. What is the name of that plate? And that plate is called Metaphysia Plate. That plate is called Metaphysia Plate. And the Metaphysia Plate is the narrow portion of the long bone between the epiphyseal and then the what? The diaphyseal. And that plate contains the growth plate or the growth hormone. So the growth of every child depends on that what? Metaphysia plate. Metaphysia plate. So, like I said earlier on, the edges will be growing, and that is because of what? Growth hormone that you can actually what? Find inside the middle. So one layer is the epiphyseal, the epiphyseal, and the other one is what? The diaphyseal plate or face. Good. So between them, we have the what? The metaphyseal plate that helps it to grow. That helps it to grow. So over here, we are looking at what? The metaphyseal plate. Metaphyseal plate. So your answer is A. A 2-year-old child has got intestinal dysbacteriosis. Intestinal dysbacteriosis, that is imbalance of microflora inside the intestine. Imbalance of microflora inside the intestine. Don't forget, every human being has some sort of, microorganisms in their body or in their intestine. Okay. But when there is too much disorder between the microorganism there, it can cause what we call dysbacteriosis. Dysbacteriosis. And they said that resulted in an hemorrhagic what? Syndrome. It resulted in hemorrhagic syndrome. So what is the most likely cause? What is the most likely cause of hemorrhage? What is the most likely cause of hemorrhage? What is the most likely cause? Now, hemorrhage simply means what? Bleeding. Isn't it? Hemorrhage simply means what? Bleeding. So you have to ask yourself, what type of vitamin, okay, will make, or vitamin deficiency will make someone to bleed? That is it. What type of vitamin will make someone to bleed? And straightly, you are thinking of what? Vitamin K insufficiency or vitamin K deficiency. If you have been following us, we've mentioned a whole lot of things about vitamin K and even ascorbic acid. We've mentioned a whole lot of things about them. In the pharmacology, we talk about how vitamin helps in coagulation or prevent bleeding. We said it is involved in what? In carboxylation of clotting factors. They are involved in carboxylation of clotting factors. Clotting factors. And clotting factors are the things that are needed to prevent what? Bleeding. To prevent bleeding. So when this vitamin is deficient, that means that there cannot be what? Carboxylation of these clotting factors, which means that they will become what? Ineffective, or they'll become inefficient. Inefficient. So over here, we're looking at what? Vitamin K deficiency or vitamin K insufficiency. So your answer is A. Vitamin K insufficiency. Vitamin K insufficiency. All right. Histological specimen presents a vessel. Histological specimen presents a vessel, the wall of which, look, the wall consists of what? Endothelium, basal membrane, and a loose connective tissue. Loose connective tissue. Loose connective tissue. Now, when having a loose connective tissue, what comes to mind? Don't forget, over here, they've not mentioned anything about what? About smooth muscles or elastic tissue or anything like that. Isn't it? So if it's having a loose connective tissue, it means that, first of all, they are referring to what? To a vein. A vein. A vein. I told you guys that the adventitial level or the adventitial layer, that is the adventitial layer, that's made up of what? The loose connective tissue. They are usually made up of the loose connective tissue, the adventitia. They are usually made up of what? The loose connective tissue. Loose connective tissue. All right. So now that place is it. So first of all, you are thinking of a vein. But what type of vein is it? Is it a muscular type of vein? No, because nothing of muscle have been shown over here. So over here, we are thinking of a vein of a non-muscular type. A vein of a non-muscular type. So your answer is what? A. Vein of a non-muscular type. A patient died from acute cardiac insufficiency. Again, do well to watch the previous video because we said so much about cardiac insufficiency and the drug you need to use. That is in pharmacology. We spoke a lot about cardiac insufficiency and the drug you need to use for both cardiac and even in chronic conditions. We spoke about them. So please take note. Now, the histological examination of the heart revealed a necrotized section in the myocardium. Now, when we say necrotized, it means that necrosis has taken place. Necrosis has taken place. And at what point can we have necrosis? Is when there is insufficient supply of blood. Insufficient supply of blood. And so, therefore, oxygen will be deprived. And when oxygen is deprived in tissues, it can lead to what? Necrosis. It can lead to necrosis. So over here, we are having a necrotized myocardium of the left ventricle. Of the left ventricle. And you see, usually in medicine, or let me say, in cardiology, the word necrotized myocardium simply means what? Myocardial infarction. Myocardial, and I believe some of you have heard about it. Myocardial infarction. That is the medical term for a necrotized myocardium. A necrotized myocardium. So every other thing here is just telling us how the necrosis is. So it's separated from undamaged tissue by the zone of hyperemic vessels, small hemorrhages, and leukocytic infiltration. So what is the diagnosis? Again, we are talking about myocardial infarction. Myocardial infarction. So over here, your answer should be D. Myocardial infarction. Why? Because there is what? A necrotized myocardium. And the right term is myocardial infarction. So your answer is D. So again, what else can be the cause of myocardial infarction? Arteriosclerosis. So people with arteriosclerosis, the coronary artery will be blocked. And this coronary artery supplies the heart with blood. So when that place is blocked or is narrowed, what happens? It means that blood supply will be decreased to the cardiomyocyte. And so therefore, necrosis can take place. Necrosis can take place. So over here, myocardial infarction. All right. Vitamin A deficiency results in the impairment of twilight vision. Name the cells of the above mentioned photoreceptor function. In other words, which cell helps in what? Or which pigment or which photosensitive pigment helps or deficiency? Just a deficiency. No, so now we have the rod and cones. These are pigments that are involved inside the eyes. That helps us to see. That helps us what? To see things very well. Now, you must know the difference between the rod and the cones. Rod and cones. And that's where the problem is for most students. The rod and the cones. Now, the rod cells are responsible for dim light vision or night vision. Again, rod cells are responsible for what? For dim light vision. So in the night, when you are in the room without light, what helps you to see is the rod. And then during the day, the cones receptors are very active. So I repeat, for night, rod receptors. For afternoon or during the day, we have the cone. We have the cone. Now, twilight vision simply means what? A night vision. Night vision. And they are saying that there is an impairment of night vision. So what photoreceptor function has been disturbed? Of course, rod cells. The rod receptor cells. So this is what? This is D. And of course, if you have deficiency of vitamin A, you know vitamin A normally leads to what? Night blindness, isn't it? It leads to night blindness. And that's because the rod cells are impaired. So your answer is what? Is D. All right. Kidneys of a man under examination shows an increased resorption of calcium ions and a decreased resorption of phosphate ions. What hormone causes this phenomenon? If I were you, I'll just ask myself, what hormone is involved in calcium reabsorption? And you know it, parathyroid hormone. And in the kidney, this parathyroid hormone blocks the reabsorption of the phosphate ions. It blocks the reabsorption of the phosphate ions and then promotes absorption. It promotes absorption of the calcium. So over here, we are thinking of what? Parathyroid hormone. So the answer is D. Or parahormone. Actually, it's parathyroid hormone, not parahormone. So the answer is D. All right. Now, during pubescence, the cells, pubescence simply means like puberty. The cells of the male sexual organs begin to produce male sex hormone called the testosterone that cause fourth secondary sexual characteristics or characters. What cell of the male sexual glands produce this hormone? What they are asking is that what cells is responsible for the production of testosterone? As simple as ABCD. What cell is responsible for the production of testosterone? And your answer is what? The Leydig cell. Now, so basically it's Leydig cell. Now, with Sertoli cells, which some of you might be confused about, Sertoli cells is like a nurse cell. When we say nurse, it means it helps in the process of spermatogenesis. In other words, it deals with sperms. It deals with the production of what? Sperms. It helps in the production of sperms, whilst Leydig cells helps in the production of what? Hormones. And that is what? The testosterone. The testosterone. The testosterone. All right. So over here, your answer is what? Is C. Is C. The largest cell. The largest cell. Okay. The specimen presents sections of hematopoietic and immunogenetic organs. Look at it. So they're looking for an organ that deals with what? Hemopoiesis, that is blood formation, and immunogenesis or immunogenetic what? Organs. That means an organ that helps the immune system to fight diseases, isn't it? And you remember I was telling you something about the thymus, and I was saying that inside the thymus, that is where cells like lymphocytes mature in. They grow and mature inside the thymus. They grow and mature inside the thymus. And when we talk about immunity, we are referring to what? Lymphocyte. When we say immunity, this guy's immune is very good. We are referring to what? To the lymphocyte. We are referring to the lymphocyte. So again, the organ has what? The lymph tissues forming different structures. In what organ does antigen independent proliferation and differentiation take place? And your answer is what? Of course, the thymus. The thymus. The thymus. So here we're thinking of what? Of A. The thymus. And again, I said why? Because we are thinking of the immunity. 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 And don't forget, lymphocytes are also blood cells. They are also blood cells. They are also blood cells. So your answer is what? Is A. Is A. A patient with thrombophlebitis, that means inflammation of the veins of the lower extremities, had got chest pain. Now, there's something about inflammation of the vein. When your veins in the lower extremity, when that vein is it's inflamed and there is thrombosis being formed. When we say thrombosis, it's like a scarring or clot. And let me put it that way, clots. You see, when you get injured, there's a clot formation on the injured place. And that that clot just helps to prevent bleeding, isn't it? The same way happens inside vessels. When a vessel is damaged, clotting takes place. But inside a vessel, we don't call it clot, but we call it what? A thrombus. We call it a thrombus. Now, this thrombus can break away. And when it breaks away, it can go and hide inside the lungs. Inside the lungs. And that can cause what? Edema formation in the lungs, called pulmonary edema. Pulmonary what? Edema. Pulmonary edema. So put that at the back of your mind. So somebody having deep vein thrombosis or thrombophlebitis or inflammation inside the lower extremities, think of embolism. Now, the word embolism simply means movement of substance from its origin to another place. That's called embolism. So you can have thromboembolism, that means thrombus is moving. We can have foreign body embolism, that means foreign body is moving. We can also have fat embolism. And fat embolism normally occurs in fractures. Or when we say somebody has multiple fractures. When somebody is having multiple fractures, that person can develop what? Fat embolism. Fat embolism. Fat embolism. So again, over here, what are we looking for? What are we looking for? We're looking for a thrombus that has entered into what? Into the lungs. And that is why this person is having what? Chest pain, blood is splitting, growing respiratory failure that causes death. So you see, when the lungs are not able to undergo correct perfusion, this can result death because you need air. You need air. And look at it. Autopsy revealed a multiple pulmonary infarction. I've told you guys that infarction means what? Necrosis. So when there's a blockage inside the lungs, what happens? It means that blood cannot flow. Because it's the blood that is carrying what? Oxygen. It can't flow. So as a result, there is what? Multiple what? Infarction. Multiple infarction. Multiple. So this you can see this multiple myocardial infarction. Multiple myocardial infarction. So what is the reason of the development? This is because thrombus has moved from its origin into the what? Into the lungs. So this we'll call it what? Pulmonary artery embolism. Pulmonary artery embolism. Pulmonary artery embolism. Pulmonary artery embolism. So the answer is what? Is E. Pulmonary artery, also called thromboembolism. Thromboembolism is the same thing. All right. A patient complains of dryness of the head skin, itching, fragility, and loss of hair. There is loss of hair. That's alopecia. After examination, he was diagnosed with seborrhea. Disturbed activity of which cells cause this condition. So what then is what? Seborrhea. Because if you don't know seborrhea, how will you be able to know the cause? So seborrhea is simply a chronic relapsing but usually mild dermatitis. Mild dermatitis. And it affects the scalp, the face, and so on and so forth. So, but basically, what happens is that it affects the sebaceous glands, which is the rich areas of the skin. The skin. So when that place is having problem, we call it what? Seborrhea, or they can have loss of hair. Don't forget, your hair follicles are one way or the other attached to the sebaceous glands, isn't it? So when that place is, is being infected or is being disturbed, what it means is that they can have a problem. So over here, we are looking at what? Cells of the sebaceous glands. Sebaceous glands. They are part of the hair follicle. Part of what? The hair follicle. So we are referring to what? A sebaceous gland. Sebaceous gland. All right. And again, what helps you to sweat? It is the sebaceous gland. It produces some oil that helps. Sometimes your face can become oily. That is because of what? The sebaceous gland in action. Sebaceous gland in action. So please take note. So the answer is B. A sensitive neural ganglion consists of a roundish neurocyte with one extension, just one, that is divided into axon and then dendrite. One divided into axon and then dendrite at some distance from the pericardium. What are these cells called? Definitely one cell that is divided into both axon and dendrite. Usually we call it what? Pseudo-unipolar. We call it pseudo-unipolar. And this consists of what? An axon that has split into two branches. It has split into two branches. One will run peripherally and one will run centrally. Centrally. So this is what? A pseudo-unipolar. So your answer is A, pseudo-unipolar. All right. So your answer is A. An embryo displays disturbed process of the dorsal mesoderm segmentation and a somite formation. Guys, somite formation. What part of the skin will have developmental abnormalities? The word somite usually refers to what? Or let me just say, somite normally divides into what we call, or it helps in the formation of tendon, cartilages, bones, and also what? Muscles, and then dermatomes. So that is the function of what? Of the somite. So again, somite divides to form what? Tendons, cartilage, bones, myotomes or muscles, and then dermatomes or dermis. dermaton or dermis. So over here, we will go in for what? Derma or dermis. Dermis, which is the same as what? Derma, dermis, 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 dermis. So your answer is what? A, dermis. So again, it divides into what? Tendon, cartilage, bone, muscles, and then what? Dermis. If you look at the options over here, your right bet or the best answer should be what? Should be derma. So your answer is A. An electron microphotography of a fragment of a proper gastric gland shows a big irregular round-shaped cell. There are areas of intracellular tubules and mitochondrial in the cytoplasm. Specify the cell. Now they are telling us that this is what? The gastric glands. Gastric gland. So even if you don't even know, assuming you don't even know, ask yourself which cell is responsible for what? For gastrin secretion. Which cell is responsible for gastrin secretion? And I think on Tuesday, we spoke something about it. So over here, we are dealing with what? Parietal cells. Parietal cells. Parietal cells. And they are released by the gene cells. They are released by the gene cells. They are released by the gene cells. But the secretion of the juice is by the parietal cells. All right. So the answer is D, parietal cells. A skin presents an exocrineous gland that has an unbranched excretory duct with a terminal part in the form of a circle opening into the duct. Opening into the duct. How is this gland called according to the morphological classification of exocrineous glands? Exocrineous gland. So, fine. People are entering. Yes. So, what is the morphological classification of this? I'm not sure of the answer over here. However, the reason why I'm saying I'm not sure of the answer they are giving here is because now alveolar glands are usually branched. Okay, alveolar glands are usually branched, and alveolar glands also have what we call the sac-like excretory portion. What the question says is a circle. It's the same thing. A sac-like circle. And their epithelia are usually what? Simple squamous. Simple squamous. And are usually branched, like I said earlier on. They are usually what? Branched. But over here, Krok, according to Krok, this one is what? Unbranched alveolar compound. Unbranched. Sorry, this is it's a simple unbranched alveoli. Simple unbranched alveoli. So maybe because it is in the question as an unbranched excretory duct. Maybe because it's in the question that it's an unbranched excretory gland. That is why they are saying that this is what? Unbranched. But usually it's supposed to be what? To be branched. So over here, we'll go with Krok. Krok says this what? A simple unbranched alveoli. Simple unbranched alveoli. So the answer is D. D. I'm hearing someone is writing my name, Dr. BAHA. Okay, so let's continue. X-ray or röntgenological examination of a skull base bones revealed an enlargement of the sella tussica. So you ask yourself, what sits on the sella tussica? Unfortunately, this is anatomy, so you must know what sits on the sella tussica. So sella tussica, that is where the pituitary gland is found. The pituitary gland is found on the sella tussica. And they're saying there's an enlargement of this sella tussica. So that means that there could be a tumor. There could be what? A tumor of the pituitary gland. Another name for the pituitary gland is what? Hypophysis. Another name for pituitary gland is hypophysis. Hypophysis. Over here, we are looking at what? Hypophysis. Hypophysis. phases. Of course, you can continue over there and even to that such bone destruction is caused by a tumor. A tumor. A tumor. All right, so this is D, hypophysis. Hypophysis. Electronic microphotography of the pulmonary alveolar wall presents a big cell, a very big cell, the alveolar wall. I think I discussed it over here with you guys that the alveolar wall or the alveoli are made up of two cells. Of course, in general, we call them what? Surfactant. But made of two cells, we have for type 1 and then what? The type 2. Type 1 is what helps in the exchange of gases. And the type 2 is what helps in the cell wall, of the alveoli, the cell wall of the alveoli. But in both of them, we call them what? Surfactant. And they are saying that in the alveolar cell wall present a big cell. Its cytoplasm has a mitochondria, developed Golgi apparatus, homophil laminated corpuscles. What is the main function of this cell? Basically, they are talking about what? The pneumocyte, also known as what? How do you call it? Pneumocyte or alveolocyte. And what is the function of the alveolocyte? They produce what? Surfactant. And these surfactants can be what? Type 1 or type 2. Type 1 or type 2. Type 1, I said, do what? They help in the exchange of gases, whilst type 2 helps in the cell wall of the alveoli. The cell wall of the alveoli. So your answer here is what? Is E. It produces surfactant. Surfactant. A pathological process in a bronchi resulted in epithelium desquamation. What cells, guys, have you seen again? Regenerate. That means they are looking at what? The regenerative stem cell. Regenerate. So over here, you are looking at what? The foundation. I told you guys, the foundation upon which everything is built. So if you build a house, the foundation is called what? Regeneration. Because even if the house comes down, the foundation could be there. And you can still build on that foundation. Okay, so over here, we are looking at what? At the basal. That is what? E. Basal. These are stem cells that helps in regeneration. They help in regeneration or cell replacement. So the answer is E. A viral infection has damaged cells that form the walls of bowel capillaries. Where are bowel produced from? Bowel are produced inside the liver and are stored inside the gallbladder, isn't it? Produced by the liver, stored inside what? The gallbladder. So again, they said there's what? An infection that has caused damage to the cells that form the wall of the bowel capillaries. They stimulate the condition of an inflow of bile into the blood of the sinusoidal capillaries. What cells are being damaged? Again, we are talking about cells of the liver. And so therefore, easily to see this is what? Hepatocyte. So the answer is what? Is E, hepatocyte. Why? Because bile are normally produced inside what? The liver. Okay. And of course, inside the liver, we have these sinusoidal capillaries. Okay. Sinusoidal capillaries. So definitely it is the cells called the hepatocyte of the liver that have been damaged or that is causing the problem in this patient. So your answer is D. E, hepatocyte. Okay, they've brought this question again. Histological specimen of a spleen. But see, they've put it in a different way. Look at the question. Histological specimen of a spleen shows a vessel. So again, a vessel has come in with a wall consisting of endothelium, subendothelial layer. Look at this. The median membrane is absent. If it is absent, what comes? What are you going to think about? And look again. They said the external membrane inosculates with the layers of the spleen connective tissue What vessel is it? Definitely, you are thinking of a vein. And secondly, since the medial side is absent, it means that this is what a non-muscular type of vein. Non-muscular type of vein. So your answer is what? Is B. Non-muscular type of vein. All right. In the course of a conditional experiment, the development of mesenchymal cells was completely inhibited. Mesenchymal cells, development of the following muscular tissue will be disturbed. So the question is, what is the function of mesenchymal cells? Mesenchymal cells. Now, a mesenchyme is a type of connective tissue that is found mostly during the development of the embryo. During the development of the embryo, it is composed mainly of ground substances with a few cells or fibers. Now, usually, what they do is that they help or they differentiate into muscle tissues or smooth muscle cells. They differentiate into what? Smooth muscle cells. They differentiate into smooth muscle cells, meaning that during development, they are involved in myogenesis. When we say myogenesis, we're referring to what? Development of muscle tissues. Development of muscle tissue. So over here, we could be looking at what? At smooth muscles. So over here, B will be more appropriate. Smooth muscular tissue. So your answer is B. Again, look at this. A patient is ill with a chronic gastritis. Went for endogastric pH metry that allowed to reveal decreased acidity of gastric juice. So again, what produces gastric juice? And your answer is, of course, parietal cells. You see, if you understand concept, you don't have to struggle to know your answers, because you know that gastric juice is produced by what? By the parietal cells. And they are found inside what? The stomach. As simple as that. So your answer is A, parietal cells. Ultramicroscopical examination of a dark hepatocyte population in the cell cytoplasm detected a developed glandular endoplasmic reticulum. Now, the reason why we call endoplasmic reticulum granular, meaning that substances have been attached to it, and those substances are proteins. Those substances are what? Are proteins. So endoplasmic reticulum with proteins, we call them what? We call them granular endoplasmic what? Reticulum. We call them what? Granular endoplasmic reticulum. Or you can be hearing something like ribosomes. Okay. Now, what function has this organelle in this cell? What is the function? And don't forget, like I said earlier on, when these people are filled with proteins, which mainly will be dealing with what? The ribosomes producing the proteins, because ribosomes are attached to it to produce the proteins. I repeat, ribosomes are attached to the endoplasmic reticulum in order to produce proteins. So we call them what? Granular. So what is the function of this organelle? Of course, to synthesize what? Proteins. As simple as that. So here you are thinking of B, to synthesize proteins. An endocrine gland with parenchyma consisting of epithelium and a neural tissue is under morphological examination. Now, the epithelial trabecles have two types of cells: chromophilic and then chromophobic. Chromophilic and then chromophobic. Identify this type of cell. Identify this type of cell. Now, over here, when we talk about the chromophores, these chromophores can be alpha cells or beta cells. When we say alpha cells, we are referring to what? Acidophils. Acidophils. And when we say beta cells, we are referring to what? Basophils. 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 So, and again, all of these are coming up from anterior pituitary gland. Anterior pituitary gland. Anterior pituitary gland. So when I say anterior pituitary gland, definitely we are talking about the pituitary. Another name for the pituitary is called what? Hypophysis. Hypophysis. So over here, your answer is what? Hypophysis. 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 All right. We have a histological specimen. Someone's microphone is on. Dr. Change. Thank you. All right. A histological specimen presents an artery. One of the membranes of its wall has flat cells lying on the basal membrane. Now, when we say basal, again, that's what? The lining, the base, isn't it? So now, when an artery has substance found on the base of the membrane, what type of cell are you thinking about? I mentioned earlier on that every cell is lined by what? Every vessel is lined by what? Endothelial cells. I made mention about it. Endothelial cells. Endothelial cells. And if you look at the description of vessels, you could see it when I was talking about the intima, the media, and then the adventitia, isn't it? They are always lined by endothelial cells, followed by the basal membrane, and so on and so forth. So over here, we're looking at endothelial cells. Endothelial cells. So the answer is A. Sections of the central nervous system has layer-wise arrangement of neurocytes, that means cells of the nervous system. Among them are cells of the following forms. They have stellate cells, fusiform cells, horizontal and pyramidal cells. What section of the central nervous system is the structure typical of? This one, we don't teach it because it's an anatomy. You must know that if you open the cortex of the brain or the cerebrum, you are going to see these layers. Actually, they have about 6 layers. 6 good layers. We can talk about the molecular or the horizontal layer. We have the external or the stellate layer, the outer pyramidal layer, the inner stellate layer, the internal pyramidal layer, and the fusiform cell layer. That is what? 6 layers. 6 layers. 6 layers. So over here, we are looking at what? At the brain, the cerebrum, cortex of the cerebrum. All right. Study of fingerprints, dactylography, is used by criminalists for personal identification as well as for diagnostic of genetic abnormalities, particularly Down syndrome. Down syndrome. What layer of the skin determines individuality of fingerprint? What layer of the skin determines individuality? Individuality. And your answer should be what? Of course, demopapillary. 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 Now you see, every finger has some, some ridges, or let me just say, I don't know, but there's some lines on everybody's finger. There are some lines. Let's say, use your thumb, for instance. Check your thumb. If you look at it critically, there are some circles or round things, isn't it? Yes. These interface or these epidermal ridges, they are more or less like friction. That's why even on your phone, those with iPhones, if you put your fingerprint there, when I come and put my fingerprint, it will not match because the lining on my finger is different from the lining on your what? On your finger. And that is called what? Demopapillary. 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 So these ridges are genetically unique to each individual. They are genetically unique to each individual. So over here, we are looking at what? At C. Demopapillary. Demopapillary. Good. A microspecimen of the submandibular salivary gland shows a basket-shaped cells concentrated around ascents and excretory duct. These cells surround bases of the serous cells and are called Myo Epitheliocytes. Myo Epitheliocytes. These cells relate to the following tissues. Now, the word myo means what? Muscles. Myo means what? Muscles. Myo means what? Muscles. So they are talking about the contractile cells that are found inside the what? Inside these muscles. So we call them what? The myoepitheliocytes or the myoepithelial cells. Myoepithelial cells. And the word myo means what? Muscle. So input, we are talking about muscular tissue. So these are muscular tissues. Muscular tissues. So the answer is what? B. All right. Infectious disease caused by contractive activity of muscles that contract and dilate eye pupils. Again, an infectious disease has caused a contractive activity of the muscles that contract and dilate the eye pupil. What functional eye system was damaged? Now look, if how do I put it? If you're looking at an object that is very far, your eye will contract in a way that you can see the object. At the same way, when the object is very close, your eye will also, move in a way that it can see the object very closely. I mean, can see the object very clearly. All right. So that we call it what? Accommodation of the eye. So when we say accommodation of the eye, we're referring to the ability of the people to contract to increase the depth of focus of the eye, or the ability of the eye to relax to decrease the focus. So all these are all what? A way of which the eye view things or the eye will do to, ascertain some things. And even as you are sitting there right now, when I put a light on your eyes, your pupil might dilate or to constrict. Okay. And when you take it out, it comes back to normal. That one also helps us to know when somebody is dead. So when you're dead, there'll be no reflexes inside your eye. There'll be no reflexes. Over here, we are looking at accommodation or accommodative. Accommodative. So your answer is A.